This is in a series of videos produced by the Caribbean and African Health Network addressing the issues surrounding the COVID-19 pandemic and its impact on our communities.
Balance of good mental health as well as physical well-being. So yeah, it was really just to focus on mental well-being, and I'm particularly keen to look at what are the strategies that we can use to improve that. And there's some questions that I've posted through which looks at the impacts of chronic stress on our physical health. So yes, so thank you for joining us. Still keep sending it round to people if you can. We just want as many people to hear about this as possible. And I'm not sure if it's been recorded. Charles, is it being recorded?
Yes, permission to record it just for our notes, but also what we intend to do is to have this as a resource. We can blank people's face out. Questions will be anonymized. So we just recording so that it becomes a resource that we will be using.
Okay. Right.
Thanks.
Okay.
Right. So we've got two distinguished guest speakers this morning. One of them was with us 2 weeks ago, and she's a GP. So Dr. Diana Asante, she's a GP based in Staffordshire, and her good friend, Dr. Mamiduku Safu, has also joined us today, and she's a consultant psychiatrist. And both of them are going to handle the subject of mental health and well-being, as Faye mentioned, and you'll be welcome to ask loads of questions. Thank you. So at this point in time, I'm going to hand over to Diana to say a few words, and then she'll pass on to Dr. Sarfo, and then who would do an opening and share some of her thoughts, but also what she's seeing on the front line, and then we can get into some Q&As.
Hello, good morning, everyone. Good to see you all again, and thanks for having me again. I hope everyone is fine.
Yes.
Yes, okay. So basically, we thought it would be a good idea to have a mental health dimension to what's going on at the moment. We are all aware of the current situation with the coronavirus pandemic, the far-reaching impact nationally, locally, even globally, and certainly the impact on people's mental health situation. So what we wanted to do today is to focus on that. There are lots of areas we can look at. Mental health is a broad topic, and mental health disorders we can probably talk about for weeks, months, or even years. But we've only got, an hour today, is that right, Charles? So we'll try and zoom in as much as possible. So thanks so much to Dr. Mamiduku Safu, who is a consultant, a very close friend. We went to secondary school together, so we've known each other for about 20 years or so. And she's done us the honors of joining today to come and give us some of her expertise. So I'll let Mamiduku tell us a bit about herself, and then just give us an intro to essentially what is mental health, what are mental health disorders, very briefly, and then very, very briefly how it's relevant to the current situation we find ourselves in, i.e. coronavirus, pandemic, COVID-19, lockdown, whatever you'd like to call it. We'll be very brief at the beginning, and then we can then go into a Q&A session so that we'll get your questions and your concerns and answer those. But we know that in the current situation, there are lots of uncertainties. People are stressed. People who never had mental health illnesses are beginning to manifest. Those who do have mental health illnesses are having worse manifestations of their symptoms. Those who had some support in place might be missing some of that support. So there are lots of things that is making everyone feel stressed, from being stressed and worried about the illness itself, to economic impact, to the children, to schools, to relationships, etc. So I'm sure there'll be a lot for us to delve into today. Over to you, Mamiduku.
Thank you very much, Dan, for the opportunity, and thank you, Charles, for the introduction. So my name is Mami Sarfo, and I'm a consultant psychiatrist based in the southwest of England. I think any opportunity, mental health is still struggling to be on parity with physical health issues. So any opportunity to talk about mental health issues is very much welcome. So thank you for the opportunity. So going on to mental health in general, and specifically, especially in this time of COVID, is quite a challenging issue, and it's becoming quite difficult and obvious for most people to cope with in the COVID issues, in the COVID climate. When we talk about mental health, just like physical health, mental health is general. So anything from stress to specific mental health issues are quite existing. When you talk about mental health, we are talking about the general terms of mental health. We're talking about general anxiety, very stressful situations in relationships, situations in bereavement, all fall under mental health. Then we have specifically mental health, mental illnesses and mental disorder. And a mental illness can be defined as a disorder of the brain or mind. So when you're talking about mental illnesses, those are what you're thinking of, that's the definition you're thinking of. And it ranges from severe anxiety to very serious mental illnesses like psychotic illnesses such as schizophrenia. The commonest mental health issues is depression, which is actually supposed to be the second debilitating condition in the worldwide. And 1 in 4 of us do get affected by mental illnesses. So it is an issue that needs to be taken seriously. But then it's well known that in minority communities such as Afro-Caribbean communities, mental health still unfortunately carries the stigma and is not really well accepted as physical health issues. So once again, talking about it and increasing the awareness and reducing stigma is always very helpful. Bringing it to the current climate of the COVID situation, I think it's right to point out that everybody is stressed by it, even professionals. Forget about those on the front line. Professionals in any clinician, almost all clinicians are anxious about it. So I think it has to be accepted. It's a normal thing to be anxious about the current climate and the current COVID situation. Anxiety, the fears of it, the worries of it is quite a normal situation to be in. And talking about it is a very good step to addressing the issues. The anxieties range from anxieties of dealing with the virus itself, the anxieties of potentially catching the virus, to the associated issues such as the financial complications, as my friend Diane alluded to, the financial complications that come with people losing their jobs or reducing their workload and invariably reducing their income, and also situations such as isolation. And not to minimize it, homeschooling is actually quite one of the challenging issues that need to be acknowledged. So all these add into people's mental health issues. Then we come to mental illnesses that, unfortunately, anybody who suffers with anxiety, this is actually not a good climate to be in, or a good time to be considering changing your medications, because it's the baseline for everybody is anxiety at this present time. And then we have the serious mental illnesses, which, due to the isolation and the people's anxieties about coming into hospital, we are increasingly finding that people are staying indoors, and we are finding them quite late in their stages of relapse or in their stages of getting unwell. So hopefully this is supposed to be a brief introduction. So hopefully this gives an overview of things, and I would welcome any questions that people would want to ask. Thank you very much.
So, Dr. Sarfo, what are you seeing on the front line at the moment in the current climate?
I think when things started, as I said, everybody was anxious about it. So people rightly followed the guidelines of staying away from the NHS services, staying indoors. So interesting enough, the encounters with patients or flow of work kind of in a way reduced. So we weren't seeing as much patients as we usually would have been seeing. But I think as the isolation has continued and people have managed their anxieties for so long on their own, now we have, in terms of mental health, now the anxieties are becoming more apparent, and they're increasingly now getting people who are significantly unwell in terms of your serious mental illnesses, or people whose anxieties unfortunately have spilled over and are coming to attention as well. So anxieties, people's depression is becoming quite apparent as well.
Okay, first question for you. The evidence repeatedly tells us that Black people are more likely to have higher rates of poor mental health and more likely to be hospitalized. Are you seeing this overrepresentation in hospitals through COVID-19?
Generally, I think not generally. So the question is a complicated one. The first thing is, I live in the southwest of England, which to a degree, talking about Black population in general is reduced. So on an anecdotal level, on a personal level, I have not had the encounters of increased mental illnesses in terms of Black folks or folks of Afro-Caribbean origin, but therefore I cannot extrapolate it to the whole country. I can only envisage that in London and in areas where Afro-Caribbean communities are quite high, it might be the case, but this is not evident in my current locality. Having said that, I think in terms of generally mental illnesses being high in Black communities, I think if you put it into context, it's more of the research supports, the idea is that migration in itself has some impact on mental health issues, and therefore it's more of, I think the statistics suggest that first generation and second generation, I think it's more second generation Afro-Caribbeans immigrants, there is some research to support that there is a high level of mental illnesses in such population, in Black population, but then it has to be put in context that it's more in the context of migration, not necessarily those who have been here for generations. It's not necessarily applicable in that sense. It's more of the first or second, I'm not sure, top of my head, but it's not necessarily all generations, but it's more, I think it's more in keeping with first and second generation immigrants in minority populations. I'm not sure if I answered your question, but
I think you did. You know, before I bring in a couple of people who have put questions in the chat, you talked about, you know, mental health manifesting itself. You know, can you tell us, you know, how, you know, mental illness or mental health issues, how they manifest themselves? And then after that, I'll bring in Brenda and Elizabeth to ask their questions.
I think if you put in the context of the current COVID climate, what is becoming more apparent is that people's anxieties are becoming quite exaggerated, and people are finding it difficult coping with the information that is coming through, and obviously coping with the very realistic possibility that one might get the disease. Just to throw in there, I think I just need to mention this before I forget. I think in what is also becoming increasingly evident to me and other Black professionals like myself within the mental health services is that there is a lurking thing about a stigma in terms of the COVID thing in Afro-Caribbean communities. And in as much as the COVID itself is anxiety provoking for everybody, but we seem to be attaching the stigma to people getting the condition, which it's not helpful for us. And this, unfortunately, I'm not sure how it started, but it's by our own doing that we seem to be increasingly, there is hints of a stigma being added to the fact of the fear of getting the disease itself. So I have had a few encounters that people have actually been very firm to be explicit about the fact that maybe an individual who's died did not die of COVID, as if he died of COVID, then it means something else. And I think we have to be very careful about it, that it's not necessary. And it's kind of, COVID can affect anybody. It doesn't affect somebody who is sinful or somebody who's done. You don't have to do anything specific to get COVID. And that is what I'm increasingly becoming aware of, that it seems to be lacking in the Black Afro-Caribbean community, and just have to be mindful of it. Going back to your question, I think also another way that the mental health is manifesting in the community is that partly because of the isolation, therefore people with serious mental illnesses, like people who have depression with psychotic symptoms, or people who are suffering with other serious psychotic illnesses such as schizophrenia, bipolar, or schizoaffective disorders, are not coming to the attention of services early enough. And therefore, by the time they are identified or they come to the attention of people, then they are quite unwell. And so that is what is unfortunately becoming the aftermath. It's coming up in terms of the limitations that the COVID has brought up, and also people then having delusions, unfortunately, associated around the COVID, the illnesses itself. That is also becoming quite apparent. Thank you.
Thanks, Doc. So Brenda, we'll take two questions, and then you and Diana can answer that. So Brenda, can you ask your question, and then followed by Elizabeth, done to Ajay.
Thank you for that. Thank you so much for opening the invitation again. I think it's a very worthy discussion to be had. One of the questions that I want to have is that we seem to be, and in my circles, we seem to be having this discussion about mental health, look out for your mental health again and again and again. How do we move from actually understanding that, yeah, the mental health is not something somebody else suffers from, but it actually impacts us as individuals? I'm a sufferer of long-term depression and anxiety, and I'm on medication. And when I have these discussions with people, it's almost like everybody nods and waves and says, yeah, that's something that you suffer from. Thanks for telling us about it. But we don't seem to be getting to the next step. And from the outside, and because I'm now more involved in mental health awareness, I can see symptoms in people, and you can see people getting progressively worse, whether it's just anxiety all the way through to, like you said, delusions and almost full-on psychosis. But to get them to take that next step before it's too late seems to be like a quantum leap almost. How do we get to that position where we actually say, we're talking about you, not your neighbor or your sister or your brother? That's my question.
Great. And then Elizabeth.
Should I address the first question before?
Okay, that's fine.
Yes. So thank you very much for. I think in a way you actually explained what we need to do really, and unfortunately, that is what you've described is actually the case. And that is where I think partly it's because of the stigma that people try to distance themselves away from it. And that is where kind of when I started, I said mental health issues, when you look at WHO records, 1 in 4 of us worldwide would suffer some form of mental illness at points in our lives. And it ranges from anxiety to the psychotic illnesses. I think the first step is reducing the stigma and accepting it. And I think increasingly, and what this is an opportunity for people to become aware of it, that we are not immune to it. We are not immune to it in the same way that you could get any physical health issue. You could get an abdominal pain. You are not in the same way anybody is not immune from abdominal pain. In the same way you are not immune from any mental illness. Yes, having said that, yes, there is research to support that there's some of the very serious mental illnesses, yes, there are some genetic predispositions to it, but we are all nobody is immune from any mental health issues. So when we're talking from stress to even the little range, stress to depression, we are all, nobody is immune to it. And I think it's about talking about it, and by talking to your friends. And I think you are doing it in a way by talking about it and by introducing yourself. And I do really commend you for mentioning that you do suffer with depression. You did it very simply, but it is a very huge issue, or very huge thing for people of especially minority people, especially Black, Afro-Caribbean communities, to come out and say, I have depression. It is a very big step. It is quite daunting for most people. But once again, as you have said, we all at points in time suffer with some form of a mental illness. By talking about it, sometimes some people suggest like depression. We have mild depression to moderate to depression to severe depression. With mild depression, the recommendation is most of the time is psychological interventions. Some people, simply put, it might be a bit of a generalization, but simply put, it might be just talking to your friend or talking to your partner or talking to your family about what it is in your head that is kind of depressing you, or what it is that is causing you the anxiety. And sometimes that alone in itself, speaking it out loud, is enough for you to kind of realize that it's all in your head. Not necessarily all, I don't want to put it that way, not necessarily all in your head, but it's a way of, it's not as bad as it was saying it out loud as it's in my head. So they are very simplistic things that we can do. But then at the same time too, there are points where you need professional help, where you need to go and see your GP, where you need to seek referral to a secondary mental health services. So just to support what you kind of, your statements earlier, mental health issues is quite rife and nobody is immune from it. Thank you.
And just to add to that, Brenda, thanks for the question. As Mami said, it's a very common situation. So, I mean, in general practice, for instance, every single day, the same way you would consult someone about, say, chest pain or tummy pain or headaches or a rash, you are bound to speak to someone about their mental health. So it's forming at about probably 5 to 10% of what we do on a daily basis. This week alone, every single day, I've spoken to someone who's anxious or who's already on antidepressants, who needs it upping or adjusting, or people who are suicidal. I've had to refer a lady whose husband sadly hanged himself, and now she's got 4 kids to contend with, all of who are feeling very irritable, very anxious. So it is something which is very present with us. It's a day-to-day thing. It's as common as the headaches that we see. It's as common as the earaches people talk about, the sore throats that people talk about. So the way for us to move the discussion from this is something out there to this is something here is for us to talk about it more, for us to remove that stigma attached to it. And as Mami said, none of us is immune from it. It can happen to anybody. And so we should be more open about it and have these discussions. And specifically for our BAME community, we should be more willing to come forward and seek help. I think we have this thing where we all think we are superhumans, or we think that, oh, if I open up and say I'm struggling, then it means that, you know, I am really struggling. But at the end of the day, what's the point to keep on struggling and then end up progressing from something you could just have had a chat with someone about, or maybe you could have had some input or started on medication, to then deteriorate to a point where, you know, you're almost at the point of no return, or you get suicidal and you start thinking of taking your life or killing yourself. So basically, let's talk about it more. let's be more open and let's be more supportive of each other and not judgmental, because that's how we can get people to come forward. Thanks.
The other Elizabeth, do you want to ask your question?
Yes, please. Thank you very much for this opportunity. Thank you, CAHN, and thank you for the two doctors that's been talking. I'll be able to articulate what I want to say because my concern is in two ways really. The first thing is, the Black community. How can we really encourage this coming together so that we can have one voice that will be representative of the BAM group? I live in Manchester, and the reason why I'm saying that is that I was just fortunate to be in a council's meeting this week. And, all of the plans, recovery plan, the ongoing plans to help and support people, it's all around, it's like very concentrated on a particular kind of peoples, for instance, say the white people, and because I was there, I was like, what about the Black community? And it was like, oh yes, that's actually going to be spoken about in a meeting that's coming up on the 28th. And I see that, sometimes we can't really keep blaming other people making a decision for us or on our behalf, because we are never there really to speak up or to represent our community. And so my own concern is that how can we start to better represent the Black minority group in our community, in our, I live in Trafford in Manchester, and Trafford is a white middle class dominated area, so even the one or two person that would want to speak, if you're not strong, your voice will be lowered down because there's not that support. So my own concern is, how do we get our voice to be more heard? Are we, for instance, like CAHN, with all that you're doing, is there like a recovery plan after the COVID-19 for the community that you represent? Because a lot of people look up to you, CAHN. And I think that's what I wanted to ask.
Okay, Elizabeth, thanks for that. Clearly our doctors don't live in GM, but yesterday we were with Andy Burnham. Prior to that, we had the Director of Public Health who leads on the work across Greater Manchester. And I'll be interested in having further conversations, because we've been trying to feed into some of the resilience planning, but there are some roadblocks, especially when it comes to the city of Manchester. So, I will be interested in having further conversations with yourself.
Sorry, can I just add this as well? That that's been worrying is that the stigmatization that this is going to bring, and probably even more racism and being discriminated. So that's another area where we have, because it's all over the place, it's all over the news. Oh, the Black people, the Asian people, they're the most affected, and sadly, some people would not just see it as a virus that's affected people; they will see it as it's your way of life. And okay, if it's our way of life, then people need help, and it's getting that help that would really get us out of whatever it is that may be the reason why we are dying of this COVID-19. I don't know if that's clear, so we need to look at what might happen as a result of this stigma, or is the Black people, where many people will misunderstand it and will turn it into something else. Thank you.
Okay, thanks. Before we get some response, there's another question. Glenda, do you want to ask yours?
Hi. Oh, I'm just looking for my camera. Hi. Yeah, there's so much there. Thank you to both doctors. Oh gosh, where do I start? Which question? No,
you were asking a question about whether mental health illness or the concerns, whether it's more manifest in the BAM community because of the way we treated society generally. So you reference the Windrush and COVID, and I think Dr. Sarfo mentioned immigration in general as well, always adding to the dynamics.
Yeah. only going by experience of what I've seen over the years, in my 50 odd years, I just think it's an amalgamation of so many things. Immigration, how people have been treated from when they first came here. Families tended to be more secretive. Families are more close in the BAME community. We tended to rely on a lot of the spiritual essence that we used to get from going to church or things like that. Do you know what I mean? So there's a lot that contributes to what we call mental health, which is about the mind. And there's so much that was said. So do you not think that there's a lot of areas to be covered, but one of the biggest things is about speaking? And if you don't have the voice, or you feel you don't have the voice to express what is going on inside of you, that's our first problem, I think. So and that's what I'm asking the doctors. You know, it's about therapy. It's about building the confidence and trust, you know, to trust someone that you're going to go to, that they're going to listen to you. They're not going to judge you. They're not going to say you're crazy, because one of the first things is, I've been through depression, you know, and that was one of my first, I think, is taking responsibility for myself and finding someone. And it took years to find someone who actually said, you're not crazy, you know what I mean? You're normal, you know, and you'll be okay. But I had to go through a process to feel better about myself, if that makes sense. So my question is, I think it's a history that BAME people have, and not just BAME people, old people, but I think we have a lot carrying on in ourselves. So I'm wondering if that's to do with our mental health. Does that make sense? I looked on a bit. So I said a lot there, because I do advocate counselling, you know. It stopped me from talking.
Okay, over to you, Dr. Sarfo, and then we'll go to Dan.
Yes, thank you very much for the questions. They are kind of very important and relevant questions. Just to address the first question to a degree, the issue of stigma that I am aware of in terms of the COVID thing is actually existing within the Black community, in terms of accepting that it's a condition that we can all have, and then you can, if you do get it, you can speak about it. But I do appreciate what you're saying in terms of there might be, in the long term, some discriminations against Black people, and I think there is some suggestion that that is actually now happening in China. Having said that, I am not aware of any research or any reports to suggest that currently in England or in the United Kingdom there is any stigmatization against Black people in the context of the COVID. What I am aware of is the fact that I think is becoming apparent, or there is limited research to suggest that COVID, for one reason or the other, I think it's more Black people tend to die of it more. I don't think, I might be wrong, but I don't think the statistics suggest that Black people are getting it more. I think the statistics are suggesting that Black people who get it tend to die of it more. And I think there are various reasons why this is happening. There are quite a lot of social, economic reasons. There are a lot of physical health reasons within the Black community why this is happening. And possibly also the fact that we, once again, that just like most other illnesses, we are seeking the attentions of professionals quite late. As the second question, the second question addressed to a degree, yes, there is a long-standing history, not to be dismissed, within, especially within the Afro-Caribbean community, of difficult encounters over the years. And yes, that has contributed to some animosity, if I can use that word, between professionals and the Black community. And therefore, we tend to kind of keep things within our communities or within ourselves until it spills over. So there is that bit about it. But yes, so addressing the first, not sure if I've addressed the first person's questions, but that's what I wanted to say about that. Coming to the second question, yes, I think it does, as you've rightly pointed out, therapy does help. My experience is that partly due to what you've alluded to, because of the history with the Black and Afro-Caribbean community, we tend not to, I have actually, most Black people that I have treated have actually found it difficult accepting any diagnosis or any suggestions. That is my experience. It is very difficult to make a recommendation about follow-up treatment to a fellow Black person. It has been easier to address, and I might be wrong, but I think in the white community, the stigma is not that high. Within the Black community, it's always very difficult, and my experience is that even with serious mental illnesses, unfortunately, it's coming to attention of professionals quite late, partly because there have had involvement with issues that the late presentations have been due to the fact that even as we are in England, people tend to seek religious input for as long as possible. And when that fails, or that is not immediately working, then they come to attention of services. So there are a few things, be it that exist within our community, that I think we need to address. Yes, there is a history there, but sometimes too, I think we also, not to dismiss the history, but I think it's a mixture of things that we just have to get the right balance of it. Yes, you can't dismiss history. It's happened and it is happening. That is not to be dismissed. But at the same time too, I think we also limit ourselves in terms of what we accept. Sometimes I've heard people say they wouldn't understand me, or they will be judging me, as you said, from their background. And people, right, I think there are a lot of assumptions that people make out there that stops them from seeking professional help. So that's kind of what I would like to say. Maybe if I haven't addressed all of them something specific, I'm happy to be readdress things. Thank you.
Diana, do you want to add anything?
Sorry, I was trying to unmute myself. Okay, can you hear me now? Yes. So in addition to what Mami has said, I'll be very brief. I'm conscious that we're running out of time. So with the first bit, I think Esther, you said something about, what are we doing in relation to, the Blacks, and is there anything more that we can be doing? So just to add on to everything else that has been said, as Mami said, the Blacks are having a disproportionate effect of the COVID. So when we get it, we're dying from it. We're having more severe illnesses from it because of underlying issues, some of which we mentioned last week, underlying health conditions, the kind of demographics around, how we live, generations living together, close proximity, etc. So that in itself has caused a lot of agitation. And just to put it in context, we've had about 10 GPs die so far nationally. And out of those 10 who have died, 9 of them are from the Bain community and only 1 is a Caucasian. So there's a lot of pressure being mounted at the moment, pushing that there should be research into, is there something actually beyond the economic reasons, beyond the social reasons, beyond the underlying health conditions, which not just the Black people have, the Caucasians have as well. Is there something else that's going on that we need to know as to why we are more predisposed? So that question hasn't quite been answered yet. They're pushing for research to go in that direction. So any forum that we can get to push to speak up for ourselves would be great. And again, I agree with Mami's point and everyone else. Look, we keep saying that we're not being represented, nothing is being done, etc. But to be fair, we are the minority, we are not the majority. And if we don't speak up for ourselves, no one is going to speak up for you. So we need to get to the point where we realize that we can't just sit there and keep saying people are not speaking for us, people are not speaking for us. We need to speak up for ourselves. And that is why fora like these are important, where we not just talk about these things, but each of us from here is an ambassador moving on to wherever we move on to. So let's keep up that good work. Then moving on to the second point, from the Preston Windrush generation side of things, I agree. The history, slavery, suffrage, all of those things are bound to have an effect on your mental health. So we're already starting from a slightly disadvantaged position, you know, so that is a baseline. But again, back to the point, look, guys, we are moving forward. We are trying to make lives better for ourselves, for our generations to come and the generations afterwards. So the first generations might have suffered the most, the second generations a bit better. You might realize that most of your kids, they don't have a clue when you tell them about people suffering. They don't have a clue when you tell them that people go without food or people have nowhere to sleep, because they haven't experienced those things firsthand. But some of us might have. So we need to try and also, again, move on and talk about these things. If you have a problem or a condition and you're speaking to your GP, you're not getting the right level of help, don't allow yourself to be dismissed. Because that is one thing I admire about the Caucasians. Look, they will not give up until they get what they want. Whereas we've already inferiorized ourselves, we've already stigmatized ourselves, we've already allowed ourselves to be coming from a low position. So we just need someone to say, oh no, and then we just take it. Because we're already feeling that way, we just take it as they are not taking us seriously. But look, it's across the board. The world is not a fair place. The world is not an easy place. We need to, if we feel something is not right, we need to keep talking until we're ahead, but we also need to be rational. We also need to be wise in the way we approach things. We shouldn't always feel as if someone is out there to get us. I think we have this impression that someone is out there to get us. Once you're Black, someone is out there to get us. I walk around feeling no one is out there to get me. And I am there to try and make the best that I can to improve situations, because they also have their issues. We might say that, yes, we are too spiritual, but the spiritual thing helps us because it gives us something to hold on to, which they might not have. People who don't go to church or don't believe in any, they might not have that to hold on to. But at the same time, let's not let that stop us from seeking help when we need help, because that's what Mami is saying. People are saying, oh, God will do it. And God has given us wisdom to seek help, and we're not seeking help, and then we're going to sit there and then we die. Meanwhile, even in the Bible, God said to them, go to the prophet, wash yourself in the river 7 times. So we still need to hold on to our spiritual side, but we need to apply wisdom and do what we need to do. Nobody's going to do it for us. Thank you.
Thanks, Diana. Right, I'm going to move on to Wendy. I think Wendy has a question, and then we will go to ST. Wendy, can you unmute yourself? Okay, well,
I just got you, sorry. Thank you very much. One of my questions are to the platform is prevention. One of the things is like healthy living, healthy being. At this moment, our people is definitely not going to the doctors. We know that. So what kind of advice can you give on the first stage? Like how can there be, healthy living, healthy, being around people, that sort of thing? Is there anything that you can advise us on, that first prevention?
Yeah, over to you, Dr. Sarfo.
I think, yes, prevention. I think the current climate or what the mental health generally has been trying to address is prevention rather than getting it. So I think it comes down to the most commonest is that exercise ends up working on both sides of the coin, exercising regularly, helps with your physical health, and there is research to support that it helps with your mental health, as well as you get some endorphins and some other chemicals changes in the body that do help with your mental health. So exercise is a very kind of good and simple example. Healthy living in terms of your dietary intakes, there is research to support that eating healthily also kind of can help the way your brain functions, or can help reduce stress to a degree. I'm not necessarily a fan of food supplements. I mean, in my view, if you eat a balanced diet properly and regularly, I think that should suffice. But then, having said that, there is some very little research, and I guess that's my issue. There is very little research to support that some food supplements, such as vitamin D's and I think omega-3 oils, do help with mental health generally. So those are, if you're a fan of food supplements, then those are food supplements that you could go with. Also, one very good preventive thing that you can do that we are all not very good at doing is identifying stress and addressing it. I think depending on if you are a first generation immigrant, or you've kind of been living in this country for quite a while, sometimes we tend to focus on just getting money and not having a break. And then sometimes I think we need to try and get the balance right. We need to get, some communities do it very well, that they would work for a while and go on holiday, and kind of, in a way, it might not be an obvious thing, or I'm not suggesting go on big holidays. You can just have a break from work and stay at home. That is as simple as that. Having a break from work regularly at a frequent time does help with reducing your stress and helps refresh you when you go in, and reducing your stress reduces your mental health. So that is also one good preventative thing. In our relationships, there is research to support that. I mean, having a confidant helps with your mental health issues. So if you are lucky enough to identify a confidant that you can speak to quite regularly, there is research to support that helps your mental health. There is some research to suggest that women especially, who have 4 children under the ages of 10, are prone to mental health issues for one reason or the other. The very obvious one is having 4 children screaming around. It's not very helpful. So in that way, identifying your limitations or helps you identify what solutions you could come with it. So having 4 children under 10 is not very helpful under your mental health, especially if you are on your own, and therefore seeking the support of relatives or friends in helping with that. That is a preventative kind of measure. If you have a family history of mental illnesses, then potentially what you could do is, in a way, identifying things early. So there are some mental illnesses that unfortunately have some gives you some genetic predisposition, and therefore by identifying it, and I think that is one of the issues that we rarely talk about it. I'm yet to do a mental health assessment of a person of Black or Afro-Caribbean origin who readily admits to the fact that there is a family history of mental illness, and it's not in a stigma or in any way, but kind of, if you're looking at it from even a lay person's point of view, if one person having a mental illness now but no family history, and then another person having mental illness but with a background of a family history of mental illnesses, I would be advising the person with a family history of mental illness to take the medications potentially for longer. So those are very small things, might be little, that add up to making a very informed decision. So one of the things that identifying your family history might be a preventative thing that you could do. as Diane said earlier on, there is research to support that people who belong to a religious group there is some protection that it offers you as a person of Christian background, Islamic background, Hinduism, some religious background, gives some level of protection. And to put it in a layman's point of view, I think if you take two children, one with their dad ever present, and one with not knowing when their dad is going to be there, there is some confidence in a way that the person who knows their dad is going to be there at the drop of a hat, that the person has over the one who doesn't. And that in a way, it's a protective factor in itself. And so that is where, if you just look at religion in its basic form, that is where it's felt that there is some protection it offers. It also offers some companionship. Some of us as first generation immigrants, the only community that we are aware of is our church community, and that is a good thing. But then once again, like everything else, you just have to be aware of the limitations. Just really adding to what Diane said, there is having your religion and taking medication, I don't think they are contraindicated. And therefore, those are things that kind of we need to think about. Having counseling from your church or talking about issues with your pastor or your church elder, it can be a preventative thing. So there are quite a few things, and I will limit it to now. Thank you.
Okay. Can I have people's permission? Because there are lots of questions in the chat box. Can we go on for slightly longer? Yeah, great. Okay. So the next question is from ST.
For everyone, thanks for the opportunity. I happen to be a mental health nurse, and I've seen some situations that is a bit confusing for me. I think there are some research being done onto it, but for my own learning and to create the awareness amongst our people. My question is, what are the impacts of vitamins deficiency and deranged blood results on BAME for psychosis experience, and the importance of or the impacts of vitamin deficiency in general to our health as BAME? Because we all know our food and lifestyle and all that, we're not getting enough vitamins in our food on a daily basis. What are the impacts of all this on our mental health? And also, I've seen some BAME young people whose blood came back, and it seems like the children have been admitted to a psychiatric unit in the first place. If those things were picked up earlier on, that there were some deficiencies affecting them and their behavior that has caused changes to their personality and their mental wellness. So what are the impacts of vitamin deficiency, deranged bloods, and how do we create that awareness for people to be aware and look out for and be more open about it, seeking help to prevent unavoidable admissions to a psychiatric unit? Thank you.
Thanks, ST. So over to Dr. Sarfo and then Diana.
Thank you very much, ST, for your question. I am not aware of any particular research or any relevant research at this present time that specifically points to a particular vitamin deficiency being the sole cause of a mental illness. Having said that, there is some suggestion that with some particular individuals or with some particular children, high sugar intake can contribute to them being hyperactive. Once again, that research is actually very limited. So then some people, there is felt to be some benefits of limiting the sugar content of some particular children. coming back to the vitamins, as I said, I'm not aware of any particular research, but the research to support that particular vitamins do kind of contribute, or deficiency of it contributes, when we talk about the general adult population or the children between 18 to 65 children, but then it's a different than when we're talking about dementia. So when we're talking about the general adult population of children, I'm not aware of any specific vitamin deficiency. I think my general view is that we try and keep a healthy diet. I think that so that would be the general thing that I would recommend that you do, the general healthy diet and healthy living. Yes, some of, depending on what community you belong to, some of our food staples potentially would have limitations in terms of some nutritional content. And I think generally, if over time the nutritional content of your meals is not great, then you have collectively, it adds to your predisposition to physical health issues, your predisposition to stress. So indirectly, then it could potentially have an impact on your mental health. So that would be the way that I am aware of that vitamins could have an impact on your mental health. Yes, we do, when I do have patients, we do kind of ask GPs to check on their general blood. We do general blood investigations. Sometimes your thyroid levels, depending on if they are high or low, yes, can have an impact on your mental health, especially in terms of depression. So that is a relevant point. So generally, I'm not aware of, as I said, vitamins per se, but there are quite a few predispositions. There is, if I'm getting your line of thinking correctly, there is this issue with, and potentially controversy with, ADHD, which is quite, it is a controversial topic in itself. And I think in Black children and Black Afro-Caribbean communities, it can be quite a tentative diagnosis to give to a child, because sometimes there is a suggestion that we do not understand or appreciate the background of such children, which may be true, but it is kind of, as I said, that diagnosis in itself, no matter what aspect of society you belong to, it is controversial in itself. And I think in Black communities, diagnosing it together with autism there is some complications with it, or it's one of those difficult diagnoses to give to people. Hopefully, I'm not sure if I've addressed your question, but that was my thinking. Thank you.
Okay, just a quick add-on. So, ST, I mean, again, I don't know whether, like Mami said, whether I'm getting the question right, but if you are saying that if people have vitamin deficiencies or they have abnormal blood tests, can that affect their mental health? I think the direct answer to that is not really, but the indirect answer to that is yes, because the manifestation. So if someone has, for instance, if you do someone's kidney function test and they've got acute kidney injury, or they got a very bad kidney function test, and they are uremic, or they've gone into renal failure, they can be behaving abnormally. So you might mistake that. If you don't do a full assessment, you might mistake this person for a psychotic patient, or because they could be delirious, you might mistake them for a mental health case, and they end up on a psychiatric ward. Vitamin D, B12 and B complex deficiencies, we know that generally vitamin D is good for memory, emotional well-being, etc. And people who don't eat adequately, like Mami said, a balanced diet is all you need, really. I think the problem is we don't really have a balanced diet. So we go chasing after all these supplements, thinking that we can use that to supplement what we should be eating from our food. Most Blacks, we like our staple, we like our meat, we like all the good things, the sweet things, but how many of us truly eat lots of fruit, lots of veg, you know, in good amounts to supply all these things. So we're always wanting one supplement or another. But anyway, going back to the question. So if someone has abnormal liver function for whatever reason, they've drunk too much alcohol or they've not looked after themselves, or they're taking some medication that's thrown their liver function out of the place, or someone has severe deficiency in vitamin D, for instance, because they've not been exposed to sunlight, they've not, for whatever reason, the color of their skin, they've not had enough sunlight, or, you know, low vitamin D, they can manifest all sorts of behavior changes, isn't it, Mami? Which isn't necessarily a mental health issue. It could be a physical health presentation, but they're presenting like that. And that is why the psychiatrists will always say that we should do the blood, we should rule out physical causes first. Because even someone with low mood, someone who's tired all the time, someone who's got sleep disturbances, it could be their thyroid, you know, it could be their kidneys all over the place. They could be anemic. That's why they're tired. They could have an infection. There's so many things that could manifest in the same way that a mental health illness can manifest. So you are right. You might be seeing patients on the ward whose bloods are abnormal and they're presenting with worsening features, or they're even delirious. But maybe the underlying problem is that they've got a deranged blood, which for whatever reason needs to be sorted. And you find out that when those things get sorted, those people are fine. Maybe they didn't actually have a mental health illness. Nevertheless, there are people who have mental health illnesses who can also have these things happen because of physical health reasons. So I don't know if that's helped, but I just thought I'd chip that in to add on to what Mami has said.
I just saw ST's comment. Yes, so I think you're referring to the fact that you're mentioning, yes, referring to potassium, and I think you mentioned vitamin D. Once again, as I said, there is some research to support, to say that vitamin D, and I'm not sure about potassium, but vitamin D specifically, some individuals who suffered with mental illnesses, it has been noted to be deficient in their when bloods have been done. But what I'm trying to say is that research is actually very limited, and it's not felt to be what at present, it's not felt that it's enough to explain the whole mental health presentation. And the other thing that kind of does not necessarily go to support vitamin D deficiency on its own being a cause of a mental illness is that in this country in general, because of the weather, there is a high number of people with vitamin D deficiency. So if that was necessarily the case, then you would be having more people presenting with mental health issues just purely because of their low vitamin D. So yes, some not being healthy, like anything, like it doesn't help you in your physical health, it would not help you in your mental health as well. But once again, I'm not aware of any specific research to say that vitamins, lack of some vitamins specifically, would lead to a mental health issues. It would indirectly might lead to your recovery being limited or your being more prone to it, but I'm not aware that lack of vitamins on their own is a cause. Thank you.
Thanks for that. We're going to take 2 more questions from Ghani and then Faye, and we'll look to, I think for, both doctors have been talking about good diet and exercise, and usually on Tuesdays we have our Healthy Heart sessions, and Dorota takes us through the physical activity, and Hiba, who is on the call now, she does the nutrition bit. So Tuesday between 1 and 2 o'clock is, a good time to join in. So we'll take Ghani's question and then Faye.
Oh, hello. Good morning, afternoon, everybody. My question is whether we actually need to now look at different ways of raising awareness, because there's been a lot of work that we've been doing within the community in terms of, trying to reduce this stigma. And it's not really making huge impact. As you've heard, the problem is still continuing. And it's actually going to be worse, given the the COVID-19 issue. So whether we need to look at whether leafleting or really trying to, reduce the stigma by, saying to everybody, we all have mental illness. I think every single one of us have some sort of mental illness, as the doctor have said. And I think also perhaps we need to look at the language that we use, because, I think, a couple of people have said, people are saying, it's your head, you're mad and all that sort of thing, which again put people off, so I just really wonder what, both doctors think about, how we change the language, and also in terms of whether there's different ways of raising awareness to actually reduce the stigma. Thank you.
Thank you very much for that question. You've actually answered the question yourself, really. I think, in my view, if you have some appreciation that you could be the one on the other side of the words that you're using, you could be the one being the word crazy being used against you, then you would have some appreciation of reducing it. So I think when you distance yourself from it, when you distance yourself from a condition or an illness, it's easy for you to use a negative word against that particular condition. But when you have some awareness or some acceptance that it could be you on the other side of the coin, then I think increasingly they be mindful of words that you use. I mean, I wouldn't use a word like crazy for anybody, but we tend to use it to insult people. So there are kind of very little things that we do that if we could start changing it, you're not changing something massive. You're changing very little things, even in terms of your language that you use. Then gaining that awareness from there within our small communities. Once again, Black and Afro-Caribbean communities, we do not do well in accepting mental health issues. It's almost some people kind of make it feel like it's like almost a curse if you just bring up mental health issues in any context with anybody, but then everybody is comfortable with abdominal pain being mentioned. They don't necessarily find that to be like you're cursing them. So as you rightly pointed out, it's just a matter of really educating ourselves in our own self, getting the acceptance that I could be the other person there. I'm not immune to it. And I think as we've said from the beginning, and as you've contributed yourself, increasingly, it's more of the education and the awareness, really. Thank you.
Yeah, talking about it more, as Mami said. And I think another thing is just, let's not feel that all that we're doing is we're not achieving anything. I think we are achieving a lot. I think that although there's a lot more to be done, people are a lot more aware of mental health illnesses than they were before. At first, people thought mental health illnesses is just someone who's at the end of the spectrum, but now people know that, things like even severe levels of stress, anxiety, depression, all those things, even grief reaction, post-traumatic stress disorder, all those things are things that could happen to anybody. It just takes one day for your life to change. And you have no control over how you're going to react to losing a family member, or having been through a stressful situation, or being a victim of a situation you have no control over. So like Mami said, we should talk about it more, but we should also know that it's that close to home. It could be anybody. But let us not give up. Whatever we're doing, we are achieving something, and we need to keep doing what we're doing. Keep raising this awareness. Keep talking about it, and I think we'll go far. Thank you.
Great. I think, we will be wrapping up and probably, bring you back again in 2 weeks if that's feasible. But then, general question. Well, there's one first about your views on IAPT versus medication, and then what can we do going forward to improve our mental health and well-being? And then a third one, it's about importance of sleep. So 3 in 1.
Yes, sorry. You said what against versus what versus medication?
So your views on IAPT.
IAPT.
Oh, okay. All right.
IAPT versus medication.
Yes.
Then the question about sleep.
the person knows the system well. So yes, IAPT just really stands for improving access to psychological interventions. And I think they are not exclusive of each other. I think the research and why IAPT is becoming more frequent, and they are trying to make it nationwide and available, easily available and accessible to everybody, is that it's felt that in a way it's a preventative thing, but also at the same time to a treatment in itself, in the sense that most mental health issues on the beginning of the spectrum, most mental health issues such as anxiety, mild depression, bereavement issues, and other very on the low side of mild things can't be addressed just purely through psychological interventions, through putting in layman's terms, through counseling, through talking about it. So I think that is why it's felt now there is a lot of money being put into these psychological services. And once again, I think we should try and avail ourselves to it. Sometimes I think the research suggests that when people have mild mental health issues, such as mild depression, you do not need medication per se, and therefore seeing a psychologist or talking to a psychologist might be enough to curtail it or stop it from continuing. Sometimes when you get to the moderate states of mental health issues, such as moderate depression or your anxieties, it's moderate levels of anxiety, then the suggestion is how the research supports a combination of medication and psychological interventions. And once again, the IAPT services do come in handy and are very useful, and there is research to support that. So most GPs would readily refer you to an IAPT services. They are all IAPTs, but I think different areas have different names for it. So all you need to see your GP, and most GPs are, on board with this and would readily refer you to IAPT services. So a combination, you can be doing IAPT and then have medications as well. They are not exclusive of each other. There are sometimes there is a point in time that you might, from severe to serious, moderate to severe mental illnesses, that at a point that you might only need medication for that time being, because you're not in a state to have those discussions or to talk about it or to have any skills in terms of psychological interventions, and therefore you stick with medications. But when you are recovering or almost recovered, then psychological interventions come in. And most of the time, the commonest one I think most people are aware of is CBT. And I think I just want to just extrapolate this a bit. The CBT, the idea of it is to give you skills that you can use in the future. So not necessarily to cure you at that point in time. I just want to explain it, because most people then find it difficult, thinking they're going in for a cure. But then the idea is to give you skills to challenge your line of thinking, which causes our anxieties, causes our depression. So hopefully I've answered that first question. I'm sorry, you would have to repeat the subsequent. And then there's
sleep.
I remember that one. Yes. Yeah. So the sleep, yes, sleep for any mental health issues, from the mild to serious mental health issues, sleep is very important, and having a good night's sleep actually does wonders, really. From mild issues such as anxiety, having a good sleep, there is evidence to suggest that it subsequently helps your day's activities. From serious mental illnesses such as bipolar affective disorder, when people have not had good sleep for 2 days, 3 days, they can go into full-blown manic episodes. So sleep, whatever way you look at it, whatever mental health or mental illness you are looking at, sleep is quite relevant and quite important. Thank you.
Dr. Asante.
Yes, very briefly. So IAPT and medication, as Mami said, is a step care model, intervention, improving the access to psychological therapy or psychotherapy. It cuts across the board. We would use it at any stage or every stage, but usually at the mild sort of phase, that's what we go for first. And then later people might need medication as well as, and then in severe cases, like she said, if you're not in the right frame of mind, then you probably can't engage, but as you get better, we can reintroduce that. Very important message to take home: IAPT or well-being service, or psychotherapy, or whatever it's called in your local area. It is accessible. Let us engage. So again, one of the things with us is that we go there thinking that you're going to give the problem to the practitioner and then leave with your cure. It doesn't work that way. We need to engage with the services, and unless we're willing to engage, it doesn't quite work. Some people come back and say, "Doctor, that was a complete waste of my time. I'm not going there again. It was just a tick box exercise, and I spent 30 minutes filling in a form. I'm not going there again." They do need to fill some boxes. They do need to get some information to have an idea. I agree that sometimes not every problem can fully be addressed by the psychotherapy, but it's the skill in addition to everything else that you're doing. And as Mami said, it's equipping you to change the way you think, change the way you process your response to the challenge or the inciting factor that's causing your anxiety or your depression or your stress or whatever. So it is important that we go there with an open mind, willing to engage, and we are positive-minded about how to get the best out of it. And there are materials there are self-help books that we can read, we can refer ourselves. At the moment in the coronavirus situation, most of them are not seeing people face-to-face, but in my surgery, for instance, they're doing telephone consultations. So we can still refer people to have telephone consultations to discuss with the practitioners, and they have more time as well. And then they also liaise with us if we need to do anything extra. When you're on medication, it doesn't stop you still tapping into psychotherapy. So it's still an ongoing thing. And those skills that you get, you can carry on through life. So I'll leave it there for that bit. The second thing, sleep and mental health, is kind of a cycle, isn't it? So if you're not sleeping well, your mental health gets worse. And if you've got mental health problems, sometimes it affects your sleep, because we find that people who are depressed, who are anxious, etc., they can't sleep properly. And the worse your sleep, or the more that you're not sleeping properly, that in itself also aggravates or worsens your mental health. So sleeping is very important. But insomnia is either acute or chronic. So if you've got a short-term sleeping problem, I haven't been sleeping well for the last week or last 2 weeks, and you come to us and you want a sleeping tablet, can I put it out there? Sleeping tablets are not a fix for sleeping problems. So every sleeping problem has an underlying reason why you can't sleep. So you're not sleeping because, and that's what we need to address. So let's not keep thinking, or let's not go out there thinking, I'm going to speak to my doctor for sleeping tablets to fix my sleeping problem. It doesn't fix a sleeping problem. It ends up causing people to become addicted to these tablets, which we call benzodiazepines, and it leaves you in a worse off state. So let's try and address what the underlying issue is causing the sleeping problem. Sometimes they might give you a short-term medication just to help you try and get yourself your cycle back on, or try and sort of get your sleeping pattern better. But it's not a fix for the sleeping problem. There's always an underlying reason to why people can't sleep. Chronic insomnia. Doctor, I've never slept since I was a baby. I have people who come, 60-year-old, 70-year-old. She said, I've never slept. I'm 60 years. I've never slept for the last 60 years. And you're thinking, really, you're still here? Okay. So those who have never slept for the last 10 years, 15 years, 20 years, again, sleeping tablets is not going to fix that problem. They try and use chronic CBT or other things. I don't know if Mami will add on to that, to try and help to address these sort of not sleeping problems. But again, sleep is one of those things that medication doesn't quite fix. So it's more of how we are looking at what's causing it, our lifestyle. Are we exercising enough? Are we eating healthily? Are we doing our sleep hygiene routines? Are we eating at the right time, switching off things that will keep the mind active at the right time? And are we treating the underlying diseases that cause us not to sleep? Full stop. Thank you on that one.
Thanks. So we're going to take, your closing remarks, and then, Faye will wrap it up. So Dr. Sarfo, and then we come back to Diana. And
yes, once again, thank you for the opportunity. Hopefully people found it helpful. All I want to say is mental health issues. Mental health is a condition that we are all prone to. Mental health in general, there isn't any shame or any stigma to it. It's in the same parity as physical health issues. and therefore let's talk about it and let's address it. In this current climate, fear, worry, and stress is quite normal for everybody, even those for clinicians are suffering from all these symptoms, and therefore let's talk about it. Talk about it with your partner, your siblings, your family. Talk about it together, and it helps relieve these anxieties. When it's not enough, or your contact with your family is not enough to contain these, then please do see your GP. Please get referred to mental health services. Leaving mental illnesses untreated for a longer period of time also means that the recovery then takes longer. So please, let's be mindful of it and address these mental health issues as much as possible. The first step in reducing the stigma is looking at yourself, that if you were in that position, would you use those words about yourself? Thank you very much.
Thanks. And Dr. Asante, as you wrap up, there's a question about those of us who work night shift and we have to do school runs in the morning, and the stresses that come with that.
Yes. Is a person asking whether that has an impact, or what was the question itself?
Well, I mean, because Dr. Sarfo said, having a good night's sleep helps. Yes. The question is about those who work night shifts and still do, in the morning have to do school runs and other.
Yeah. So the sleeping pattern is quite important, and if you do work night shifts, it is quite tricky. But if you're someone who does nights all the time, then you almost have a slightly sort of reversed circadian rhythm where your day is your night and your night is your day. But we all know that when you do nights, you don't just sleep during the daytime. You've got other things to do, so you end up not sleeping enough. But again, to push home the point, we do need to try and make a protected time to sleep and have a regular sort of sleeping time as much as possible, so that our body can have that regular rhythm to it. Because if you're sort of sleeping in the day today, sleeping at night tomorrow, sleeping in the afternoon the next day, then your body is really all over the place. The hormones that regulate your sleep are confused. They're not sure what they're doing. And that in itself can also make your sleeping pattern erratic. So even if you're a night shift worker, try and establish as much as possible some kind of routine to help your body to also sort of rhythmize itself, or sort of get itself into a pattern. Otherwise, yes, it can have an impact. It can make you not sleep properly. Then you become tired, you become more agitated, more stressed, you're not concentrating very well. So I hope that answers that bit. And just to wrap up, thank you all for giving us the opportunity to be a part of this. And well done to CAHN as well for the good work you're doing. And I want to say special thanks to Mami as well. I literally picked the phone up last week and I was like, oh, Mami, I need you to come along to go and do this with me. I do that to her quite a lot. Like the night before, I can say, we're doing this tomorrow, what do you think? And she never says no. She's such a wealth of resource and wealth of knowledge. So special thanks to her. But just to wrap up, mental health is very important. It's very at home for all of us. As she said, it could happen to anyone. Let's have an open mind about it, the same way we think about physical health. Let us not apply any stigma to it. Let us be free to discuss with people who we can trust and people who we know would be able to offer the right level of support. And if you are struggling, do ask for help. Don't carry on struggling like that. But let's remember simple things like eating healthily, having a balanced diet, exercising regularly, having time to de-stress. Take some time out. One thing we're not good at, like Mami said, we never have a break, we never have holidays. We take our holidays and we go and do a second job. We save up and then we use the money to go and build a house we never live in. We don't have time for ourselves. We don't protect ourselves. Self-preservation is important. And most importantly, let's be there for one another, because that's a very important thing. And one thing that I would like to say, let's not walk around thinking anyone is out there to get us. We need to push our case forward, but let us walk around with a positive mind that we are going to be the ones to make a difference for our generation, and stop blaming others. Thank you.
Thanks, Dr. Asante and Dr. Sarfo. Yeah, before Faye says a few words to close us, next week we're going to have a neonates consultant, and looking at the COVID situation, maternity, you know, and I'm sure Faye will be making contributions next week as well. So probably next 2 weeks or 3 weeks time, we will have Dr. Sarfo and Dr. Asante back again. So over to you, Faye.
Okay, Dr. Asante and Dr. Sarfo, thank you so much for your input today. It's been really, really helpful. I think there's so much that's going on around mental health and well-being, and it's a long-standing issue in our community. And I think, you know, for me, it's about what you've just said, Dr. Asante, about how we perceive ourselves to be. You know, often we kind of look at ourselves as being oppressed, as inferior, you know, and some of those chronic daily stresses do cause us to have, you know, some of the underlying conditions that we talk about, some of the allostatic load that we bear cause us to have some of the high blood pressures and resulting in other health conditions. So I think it's really important about how our mindsets do need to change, so we're more positive about ourselves. So I think it needs a lot more sessions for our community around how we improve our mental well-being. But I should say thank you everybody for attending. We've had good attendance at this session today. As I say, you know, mental health is so important. You know, it feeds into our physical health, and we'd love to have you both back again in the future. So thank you everybody. Stay safe, stay well, look after yourselves, and hopefully see you all on Tuesday when we talk about, you know, cholesterol and the impact that actually has on us, and also with Director again doing some physical activity. So thank you everybody, and goodbye.
Thank you everybody, and have a good weekend.